Patient-centred care is, I think, fundamental. It sounds an obvious statement that we put patients at the centre of our health policy, but it's not always the case. Sometimes you find health services are provided, and they appear to be provided at least, for the benefit of the people working in them. Sometimes they seem to be provided for the benefit of some ideology of the policy-making government or body that brings them in. It must always be the case that the patient is central. It must always be the case that the patient's experience is fed into it, that the patient is part of the decision-making for decisions affecting that patient. And also, I believe patients should be involved in the decision-making of the planning of future services, so that that can all help for health policy as a whole. There is, of course, a but, and the but, I think, in this case is, what if the interests of an individual patient are so expensive or so complex that they mean other patients would not be able to have their needs met. And there you have the very difficult task of deciding that whether it's that in this case, yes, the money must be found to provide what's needed by this patient, or whether you say, I'm sorry, we can't do that because we could, with that same money, treat a whole 200 patients for a lesser condition. Very difficult questions to answer, but they have to be faced from time to time, because sadly we can't do everything now as we would like. But the basic answer to the question is yes, of course, patients must be central. That's why we have health policy. And I tell you, if any policymaker is a patient, they know exactly what I mean.